Hello everyone, welcome to Caliphate Nurses' first live presentation. I am Salih Osman Shuni. I am Nas Salih Osman Shuni, the host for today's presentation. And the guest speaker of today's live presentation is Nas Abdullahi Musa, who is currently a clinical instructor at College of Nursing Sciences, Sokoto. And the topic of discussion is drugs administration. It is the most common and most carried out procedure in the hospital settings. And it is one, drug administration is one of the cardinal roles of nurses after the drugs are being prescribed and ordered by the physician. But what do you think nurses need to know on drugs administration? And how are we supposed to administer those drugs as nurses? And what should we observe? What should we observe before or after administering drugs? Follow us today with Nas Abdullahi Musa to hear all of this. People who are willing to contribute on this topic should please do so under the comment section. They should make their suggestions, their questions, and contributions. Before Nas Abdullahi Musa came in, Nas Abdullahi Musa, I'm waiting for you to send an invitation to join the video. People are getting ready to have a wonderful discussion with you on drugs administration. I can see Nabila. Abdullahi Musa. Nas Abdullahi Musa, I'm waiting for you. Please send a request to join the video. That's Abdullahi Musa. We are waiting for you. That's Abdullahi Musa, if you can hear me. I cannot see you. Oh my goodness. Rahama is here. I can see you now. That's Abdullah Musa. Are you there?
All right.
Thank you. Thank you for coming. Thank you for joining our live presentation.
All right.
Mr. President,
Sorry
I would like to start now because we don't have much time and we want to make this presentation as quickly as possible because you know this weather.
Yes. Yeah.
People are so eager to get to sleep.
Yes.
I would like to first start with asking, what is drug? What can you say about a drug? When we say drug, what do we mean by that?
All right. Basically, I hope good evening all. Hello.
Good evening. Just continue. They are hearing you.
All right. Before I proceed, I would like to introduce myself to everyone. So
I already do that.
All right. So no problem. So as the host asked, drug is any substance that when taken into the body, it can yield a therapeutic effect. That therapeutic effect is basically work or the action produced by drugs when taken into the body. So drugs can be used in such a way that for prevention of disease, that means there are some certain drugs that are used for the prevention of disease, particularly vaccines. And we have drugs that are used for the treatment. That means it may either be antibiotic, analgesic to treat a certain disease condition. And there are some
Yes.
drugs that can be used, or substances that are basically drugs used for diagnosis. So such substances, like a person that has a gastrointestinal problem, we can use OFEC. That OFEC is a substance which can be used for the diagnosis, and also can be used in diagnosis for condition particularly affecting urinary tract.
Mm. Thank
So
you, Mr.
each
President.
drug each drug has a certain uh, therapeutic effect or therapeutic function to perform, depending on the drugs prescribed or depending on the types of drugs given. So that means,
All of
for example,
prescription.
antibiotic, they are basically to kill or to hinder the proliferation, the multiplication of microorganisms. And analgesic, they are basically used to just make a person just have a relief from a pain. And anti-inflammatory, they are basically used for inflammation, in case of inflammation, when an individual got an injury or inflammation. So that is just a little bit about it.
Thank you, Nas Abdullahi. Then the next question is, I know that when we talk about drug administration, it is one cardinal procedure that nurses used to carry
Yes,
out either in the
yes,
hospital or any other places. But this drug administration can only be done with the order or recommendation by a physician. So when we say
yes,
drug
yes.
administration, what specifically we mean by that? Drugs
So basically,
administration.
drug administration, when we say drug administration, is a procedure that deals with the process of administering drugs into the various route of administration. So such procedure and is basically or is solemnly rely on nurses. That is to say, drug administration is basically nurses procedure. Doctors are the one precisely prescribing the drugs, but nurses are responsible for administering such drugs. So failure for or ineffectiveness to administration of such drugs may lead to production of or may lead to result into production of inappropriate or effective treatment, so far as the drugs is not given in such a way that is supposed to be done. So
That
that
is to
is
say,
a little bit about drug administration.
that is to say, a nurse must have the knowledge of drugs, must have the knowledge of medicines, because
Of course.
something is
Of
irrelevant
course.
to for a nurse to know so much
Yes,
about
yes.
drugs.
Yes, of course, of course. Nurses play an
Mm-hmm.
integral role in the administration of drugs. So it is very essential for a nurse to know more about drugs, particularly to know the name of the drugs, to know the mode of action, to know the indication, to know the side effect, to know the contraindication. Because once such drug is being administered by a nurse, it's the responsibility of the nurse to monitor the patient for any side of effect, and even in a such a way that maybe a doctor can prescribe a drugs, which maybe it is contraindicated to a condition of the patient.
Certain condition.
Yeah, yes, yes.
Yes.
And nurses, they are the one that spend almost the time with the patient, and
All the
they are
time
the
with
one.
patient.
Yes, yes, they are the one know the condition that the patient is suffering, and so it's very essential for them to know the contraindication, because in a such a way,
I want
maybe
to question you, sir. Even the doctors, they know the
uh,
condition of the patient, but
of course,
I think it is of paramount importance for nurses to know much about drugs, because there may be sometimes that the doctor made a mistake while
yes,
prescribing a
yes,
drug. So once a
yes,
nurse is not knowledgeable about drugs, he cannot basically understand that this social drugs is contraindicated to patient. So I think it is
Yeah.
very, very relevant for a nurse to have vast
Yes.
knowledge on drugs.
Exactly.
Thank
Exactly.
you. Can I move to another question?
All right. All right. Go ahead.
Because we are having students
Okay.
in view. We are
Okay.
viewing all we are doing. So I think we should give enough explanation and simple explanation that they will understand on this drug administration. I think this procedure is being carried out to them at school.
Yeah.
So by viewing this discussion, they might have more knowledge on what drug administration is. Now,
Okay.
the next
So
question is, can I move ahead?
yeah, go move ahead. Move ahead. I can hear you.
Mhm. Are there any guidelines while administering drugs? Are there any principles we supposed to, as a nurse, we're supposed to follow before we administer a drug?
So as I mentioned earlier, nurses play an integral role in administration of drugs, and I keep repeating it because administration of drugs is basically nurses' procedure. So when there is failure in the administration of such drugs, so the results that needed or the therapeutic effect that needed for a particular drug to build it, it may not be there. So in that case, the nurses need to know the rules and regulations while giving the drugs. So
That is
before,
the principles of
yes,
drugs
yes, that is the
administration
principles or guidelines uh, governing drugs
in
administration.
administering drugs.
Yes, yes, yes. One of
Okay.
which I will started by just the simple ones that I know most of us have known it, knew it, particularly the 5 R's. That means that 5 R's stand for right patient. That means before you start administering the patient, you have to know the right patient. The patient that's supposed to be
Yes.
given such drug. Maybe they prescribe a drug to patient A. So maybe if you don't know the patient, you may mistakenly go and administer it to patient B, while the patient B may not require such drugs. Then the next one, right drugs. That means you have to know the drugs given to the patient. Maybe they
Mhm.
may prescribe a particular drugs mistakenly without knowing the drugs. Maybe you may administer it wrongly. Then the next one is right route. That right route, we have so many routes of drugs administration, which you
Yes.
as a nurse, you have to know a particular route that a particular drugs is being administered. Maybe a drugs can be administered. There are some certain drugs that cannot be administered intravenously. So therefore, for a nurse, he need to know the way he will administer it. Maybe example, I cited the example was the diclofenac. Diclofenac injection can be
Mm.
given IM. So therefore, it cannot be given IV. So it is very essential for a nurse to know the route of drugs administration. Next one, we have the right dose. And right dose, it has to do with
Mr.
such
Presenter,
amount. Yes,
Presenter,
yes,
we
yes.
have two of our lecturers here that want to join this conversation.
All
Maybe they
right,
will give their own contribution at the end of this
all right,
discussion. Can I add
all
them?
right. Yes, yes, add them.
Okay, thank you.
Yes, yes.
We should go on.
All right. So we have the right dose. That right dose, let's say it in a layman, the amount needed, or the amount of drugs needed, which we know the drugs is basically common some in milligram, some in in mils, some in international units, depending on the drugs. So we need to know
Mm.
the drugs. We need to know the dosage that have been prescribed. Maybe a dose can be given to a patient, said you give to the patient 50 milligram. So you're supposed to know the dosage given. If you assist such dosage, it may lead to a negative effect to the patient. So you need to know the right dose exactly. Then the last one,
Thank
you
you.
need to know uh, the right. Hello.
I can hear you.
Yeah. So
Everyone can hear you.
so I think the next one As a nurse, you need to monitor the patient vital sign before you administer the drugs. In monitoring the patient vital sign, so there are some drugs that cannot be administered when the patient vital sign are altered. I will give example with dogozin. Dogozin, you know, is a drugs given to a patient who have heart problem. So when the heart, when the pulse of the patient is below 16, is below 60, sorry. When the pulse of the patient is below 60, dogozin is contraindicated. So you have to monitor the patient vital sign before starting giving such drugs. And after, you need to also monitor the patient vital sign. And the next thing is you have to check the drugs for the potency of the drugs and also the expiring date. So in such a way, you may prevent administering drugs that is already expired. And also another guide is before you administer drugs, you need to check the drugs, particularly drugs, example like syrup or suspension. You need to check their cover and make sure that they are properly intact. And likewise, after finishing the administration, you need to cover them intact. The next guide is you shouldn't, after administration, you shouldn't left the drugs on the bedside or on the side or within the easy reach of the patient, despite the fact that there are some hospitals that usually leave the drugs with the patient. Because in that case, you know, we have some drugs that are example that are this for example narcotic
that have addiction.
That are addictive. Yes.
Drugs that have addiction.
So the patient, maybe you can leave it by the side bed of the patient. The patient unknowingly to the patient
may end up using it.
Yeah, yes, using it.
Misusing drugs.
So it's better. It's better you, after administering drugs, the drugs should be carried and keep in the in the box.
Cupboard.
Particularly such narcotic drugs, we have is particular box that that such drug can be kept. So in a standard hospital, you may see some kind of things like that. And also, one important thing is documentation. So I want to draw our attention here is nurses should duly document whatever the procedure or whatever the services rendered to the patient, because it may serve as a legal vehicle. So while if you administer a drugs, please document the type of drug given, document the type, document the route. It may serve as a legal backup.
Evidence.
Yes, despite the fact that there is workload or there is work burden to us, but that should not hinder us from carrying the normality. I think this is some of the guidelines or principles while administering the drugs.
Before we take off much of our time, let me quickly move to the terms you use while presenting on Sunday. You made mention of the common terms we need to know, such as drug abuse, drug addiction, drug dependence, drug misuse. I want you, the presenter, to please give us a brief explanation of these three: drug abuse, drug dependence, and drug misuse. What are they, and what can differentiate between one from the other?
Yes. So these three cardinals or these three terms, sometimes they can be misplaced. So when we say drug abuse basically means is the illegal use of psychoactive drug or psychoactive substances that affects the individual physically, psychologically, socially, emotionally, and otherwise. So this is to term as drug abuse. That means for a situation to drug abuse is basically means use of psychoactive substances. When we say psychoactive substances, those substances that have influence or that can easily trigger or alter our mental processes. So such situation is termed as drug abuse. When we say drug misuse, drug misuse is term used when we say drug misuse is referred to as use of drugs that is contrary to its legal and medical order. So in drug abuse and drug misuse, they are used interchangeably by some.
You mean drug misuse is the use of drug against the order of the of the physician,
Against
or
the
maybe
legal,
you are ordered to
and order
take
of the physician.
two tablets, but you end up taking 4 tablets. That is drug misuse.
That is misuse. Yes.
Thank you.
That is misuse.
Then the other
And
one.
the last one is drug dependence, right? The
Misuse,
last one is
drug dependence.
drug dependence. So drug dependence is also a situation whereby an individual is become addictive to a particular drugs. That means that individual cannot do without taking such drugs. And in that situation, when that individual is being withdrawn from taking such drugs without taking necessary action, it may lead to a situation called withdrawal syndrome. Yeah, it may lead to withdrawal syndrome when withdrew without taking necessary action. So it may lead to withdrawal syndrome. So that withdrawal syndrome.
But one thing I learned, sir. Okay. One thing I learned is that an individual who is abusing drugs may end up becoming drug dependent. Is that true?
Yes, it's true. Because when you keep using such drug, your body
will become addicted.
Used to it.
Very leading to being drug dependent.
Yes, drug dependent. That means you cannot do without it.
You.
Yes.
Okay. Now, for the students that are here with us, I would like you to please quickly and briefly give us an explanation on what are the stages the drugs follows before they carry out their action in the human body, or maybe the mechanism of drug action for the student in a simpler terms, sir, for the student to understand what we are discussing.
So, despite the fact that when we say drug action, process that drugs follow before it produce a desired effect or produce a therapeutic effect. So it's something that is brought. But considering that the peoples we are together with, and for people understanding, we can make it in a concise way. So we have 4 stages that drugs follows when taken or when administered into the patient. The first one, we have what we call biotransformation. So that biotransformation, one drug is taken either orally or whatever the route that drug is being taken. So that is what we call biotransformation. This biotransformation, it deals with breakdown of that drugs into a simpler term or into a simpler way, the way it can be absorbed into the body. That means there are some certain enzymes that will act on it in order to convert it into a simpler way that can be absorbed by the body. From biotransformation, we will move to absorption. In absorption, that is where the chemical composition, that means the chemical composition that will yield a therapeutic effect, will be absorbed into the body system. It may either be when it is administered directly into the blood, that is intravenously, it will go around, it will be absorbed into the bloodstream and transported to the area where it needed. Then we have what we call transportation or distribution. So in transportation or distribution, it's a stage whereby the drugs, after it's been break down, absorbed, and it will be transported into the various part of the body where the action is needed. So in that case, there is what we call receptors. So these receptors, they are responsible for binding with a particular drugs and take it into the area of action. And each drug has its own receptors that is responsible for transporting it, which will bind with it and take it into the area of action. I will give a simple example. Maybe you are feeling headache, and they will give you drugs to take orally. So you see, you wonder, you take drugs orally, and how will it go and
it has
produce the
effect on
desired
head.
effect, yes, on your head? Or you take it IV in your muscles, and how you think it will go into the head and produce a desired effect? Yes, so it has to follow this process, and it will be absorbed, digest, absorb, bind with the receptors, and transfer into
Be
the
taken by the
yes,
receptors.
and take it into the area of action. Then the last one is elimination or excretion. So that elimination, after such substances that needed to produce a desired effect, like for example, when you take a food, some food substances, they are needed to produce. They are taken as the ingredient that are needed for the body, which will help for the growth of the tissue and the cell. So likewise, drugs, after it's been administered, there are some elements that are not needed in the body, which will be excreted out of the body. So it may be either excreted through the urinary tract, that is through the urine, or through sweating, or through
Through the skin.
or through the skin, or through the respiratory tract. It can be eliminated in such way. So that means liver and kidney, they play an integral role in the drugs metabolism. And in absorption, there are some things I needed to add. So we have three major ways where drugs can be absorbed. It can be absorbed in the gastrointestinal tract, or respiratory tract, or mucous membrane, where they can be absorbed and taken into the area of action. So in elimination, kidney play a vital role, and also liver play an integral role in drugs metabolism. When these organs have been affected, so drugs action and metabolism can be affected. So
Time is becoming against us because we have less than 10 minutes to run off this live presentation, sir. But before we run up, I would like to mention the routes of drug administration. The routes, as you have mentioned before, depends on the type of drug. Some drugs are tablets and they can only be taken orally. Some are injectable, they can only be given through IMO IV. Some are given, some are suppressed, and some are drops. They can only be dropped either through the eye or nose or ears. So let's summarize, even though we did not receive any question from the comment section. I've tried to add the two of our teachers, but I don't know what is wrong. I cannot add them.
Okay, so
but let's summarize this presentation. In summary, what are you going to say?
So, in summary, drug administration, it deals with procedure of administering drugs into the various routes of administration. And like I mentioned earlier, we have so many routes of drug administration, in which we have oral administration, that is way of administering drugs through the mouth, that is orally. There are some certain drugs that can be administered in such way. We have tablets, syrup, suspension, capsule, and the rest. We have what you call topical, those that can be applied in the skin, and they can be absorbed and transported to the area of action. Yes. In such a way, such drug, example of which we have cream, we have ointment, and we have then we have the next one. We have what you call parenteral. In parenteral is a route of administering drug other than the mouth. That means the drugs is not being taken through the mouth. Under
Okay.
which we have subsection. We have what we call intramuscular. In intramuscular, that is a procedure of administering drugs through the muscles. That means through the large muscles in the body. But precisely, we have four main area or four main sites of administering IM injection, which we have dealt with. That is the muscles that are found here in the within the humerus. That is above the humerus. The muscles that is here in between this joint. The joint here, this joint is called I think the joint here that is in between the scapula and the humerus. Yes, and the humerus. So this joint,
At the
this
deltoid muscle.
yes,
Is
at the
that
deltoid
deltoid
muscles.
muscle?
Yes, the muscles here. So that
We are out of time, sir.
okay,
We are out of time, sir. Summarize, please.
okay. So the next is we have what we call vaginal route, where the drugs is administered through
Okay.
vaginally, and we have what we
Started.
call yes, inserted into the vagina, and we have what we call rectal, where the drugs can be administered through the rectum. Yes, and such drugs they are called suppositories, which can be administered in the rectum. We have example, we have vasocodil, which is laxative,
Okay.
and
Okay.
we have drug we have glycerin. It's also a drug that can be administered through such, and we have what you call inhalation. That is drug that can be administered and be
That they held
inhaled
through the
through the
nose,
trachea. Yes, and go down to the trachea. We have
such as
example,
anti
yeah,
for
Ventolin.
asthma, like
Yes, we have,
Ventolin and salbutamol.
yes, that is bronchodilator.
Okay.
Yes, we use bronchodilator, and we have what we call sublingual. Under that sublingual, drugs that can be administered under the tongue. We have some antihypertensive drug that can be administered in such way.
Summarize, sir. Summary, sir.
All right, so in summary, as I mentioned, drug administration is a nurse's procedure, and it deals with the administration of drugs into the various way of administering drugs. And what I'll draw our attention here, this guideline that I have mentioned, 5 R's, taking of patient vital sign, they are very essential before administering drugs. And what I would like to tell us, no, doctors are responsible for prescribing drugs, but nurses are responsible for administering such drugs. So it is our duty to administer drugs. Likewise, monitor the patient for any side effect, and to make sure that the drugs is administered in the right way, and correct dose are being administered. So I think
Thank
due
you
to the
very
time
much.
factor,
Thank you for your
we'll
time.
cease here.
Thank you
Yes.
for everything, sir.
Thank
Thank
you
you for the
everyone for listening.
sacrifice. Thank you for giving us a wonderful presentation. Here comes
Thank
to
you.
the end of this presentation. All of us here at Caliphate Nurses do hope you appreciate this and it does increase to your knowledge.
All
Um,
right.
to all the nurses, I do urge us all to please further our in educational career. We
Yes,
should
yes.
also vent ourselves into research so that we will make ourselves up to date on the advancement in the healthcare system.
Yes,
And you
yes.
shouldn't forget to like our page and follow all of our other social media handles. I
Yes, yes.
am once again Nasad Manshuni, and thank you and kudos to our speaker, Nas Abdullahi Musa from College of Nursing Sciences, Sokoto. Thank you for having you, sir, and thank you
Thank you.
everyone for watching.